Dr. Jane, and this is my assistant Mary, and you'll have to forgive her, she has this overwhelming need to touch herself. So if you see that, that's just part of her nervousness, okay? So, for verification purposes, could I have you please state your name and your date of birth?
It's Alyssa McLeod, 2864.
Thank you very much. And I understand that you were in a serious accident a few years back, and you're fully recovered, and have lost some of your memory, so you have not had a pap smear since, and would like us to explain the situation?
Yes.
Is that correct? Mary, are you comfortable in helping me with this today?
Mm-hmm.
Great. All right, so these are the instruments that we're going to need in order to perform your pap smear today. And we have a speculum. And then, depending on which pap smear I choose to do, depending on what I see on the cervix once I open it, we could be using the SurePath, which will go out to pathology, the Thin Prep, which also will go out to cytology, and then we also have the Prep Pack, which we can actually look under the slides here and view them ourselves. Because you are over 40, you are required for us to test your stool sample to make sure that you are not having any blood in your stool. Okay, so in order to perform this, the first thing that we would do is we would take the speculum, and depending on which test I decide to use, we will either lubricate this with the lubrication, or we would just run it under warm water, okay? And then the next thing that we would do is we would have you lay down on a table with your feet up in the stirrups. We would ask you to push to the edge of the table so that we could get a nice view of the cervix. I'll take the speculum and insert it and open it wide enough to get a good view. The next thing that we would do is we would take our scraper. This goes in to a certain part of the cervix where we can get a good sample, tissue sample, and we would just wipe it on the slide. And then this is going to actually scrape the walls of the uterus, and we would also put that on the slide. And the last thing that we would do to test for any diseases that we may see is do a cervical brushing, which again would go on this slide. And in order to keep that cohesive, we would have to put a cytology fixative gel upon here before looking under the microscope. If we so choose to do the either SurePrep or the Thin Prep, which I do use on most patients, the only reason that I would use this other one is if for some reason after I looked, I saw that there might be issues going on and really needed to get a fine tune and do it kind of immediately as opposed to going on to cytology. So for you today, we'll most likely use our sweeper in either the SurePath or the Thin Prep. Yep, and you can actually leave that uncovered for me, please. And if you could uncover the Thin Prep. Since I won't know until I get in, the difference being is that if I do the SurePath, we're going to take this, and again it has that little inlet like our cervical scraper did, that's just going to be able to scrape all the 3 different areas that we need. And if it's going to go to SurePath, I'm just going to leave it like this with your name and your date of birth and all your identification, which will go right off to pathology. If I choose to do the Thin Prep, then this little brush comes off, and we just put it in the cup and put the cover on, and again, send that out to pathology. The last thing that we would do is we would do a rectal exam, and since you do not have memory, and I have gloves that were too small, normally I would put my gloves on, and what I would do is I would go in through the rectum, and I would take a sample of stool. Would you like to bend over, Mary, and I could explain that to her? We would take a sample of stool, and we would just put 2 little dabs on the front part where it says A and B. We would close this up, open the back, and we would know instantaneously whether you had any blood in your stool. We would just take a drop and put it on each area that contains the stool, and then there is a control right on this card that shows what a positive read would look like and a negative read. and this is what we look for. And that's basically all that will take place in your exam today. Do you have any questions for us?
No, I think I'm all set.
Okay, did we do a good enough job in explaining the procedure?
Yep, I think I have my memory back now.
We thank you for your patience, and we'll be back. You can undress completely, and we will also teach you how to do a rest exam.